Now, you may have heard that your friend Sally's baby slipped out right as soon as she sneezed, but another friend had to push for 3 hours. So why does pushing time vary so much? And what can you do to decrease the amount of time you're pushing? And if you're sitting here thinking, Hillary, 3 hours, that surprises a lot of people. The average pushing time on your first baby is actually 2 hours. So that is an average. That means some people go less and some people go more. So it's important to know these different things before you come into your delivery so that you're not surprised when it's time to push. And I got to tell you, 20 years in the labor and delivery room, I was always surprised too. Sometimes you could tell if a baby was going to come out pretty quickly, but sometimes we were just shocked that it took 3 hours or, it happened really, really quickly. So we can't always tell which way it's going to go. And sometimes you just pass a barrier and then baby comes out very quickly. So it really depends person to person. The first one is baby's position. So you might have heard of a baby who is OP, which means that they are looking up, kind of out to your belly button, versus a baby that's in the best position for delivery will be looking back towards your bum hole. So looking out is called OP. A lot of times those people will have back labor, and that can be a position, especially if baby's still in that position while you're pushing. Usually baby will turn at some point, but if they're still in that position while you're pushing, baby's head just doesn't flex as well to come out of the birth canal. In addition to that, sometimes baby just gets in kind of a wonky spot. So their head's turned a little bit to the side, or, they might have an arm in the way. Baby's position can be a big deal. Now, you're like, Hillary, what can I do about baby's position? The key here is using movement to your advantage. During early labor, you're trying to get that baby into the best spot. And then while you're in active labor, you're still trying to move and give baby their best position. If you get into the bed and you just lay in the fetal position and you don't move at all, baby is going to do that same thing. They're going to stick in one position and they're not going to move at all. So the more you can incorporate movement into your labor, even with an epidural, I'm saying turning side to side. You don't need to do lunges and squats if you have an epidural, but there are things that you can do. And there is a pro tip here. If your partner helps to get involved, especially if you have an epidural, you are going to get better movement during your labor, because as a nurse, it's really hard to turn a patient who can't move their legs very well all on our own. But if your partner comes in and helps us, we can turn you more frequently rather than having to go find a buddy at the nurse's station. So that's a pro tip. Partners can be really helpful in this. And I always encourage patients to change position about every 30 minutes if they're not actually asleep. If you are asleep, relax, because sometimes that relaxation can help baby come right into the right spot. Plus, who doesn't love sleep? Number 2 is, what number baby is it? Sally down the street who sneezed her baby out, probably it was her 5th baby, right? I have definitely been in deliveries where we were not allowed to laugh or cough or anything like that because we're waiting for the provider to come. So the number of the baby definitely makes a difference. Your first baby is most likely going to be your longest pushing time. Although for me, my second baby was actually a pound larger, so I pushed quite a long time with him as well. But that's something to keep in mind. Your first baby is usually more, and then each subsequent baby less, because that area has been stretched out. They have paved the path for this next baby. And like I said before, baby size. A 6-pound baby is easier to push out than a 9-pound baby. And so if you have babies of differing size, like I did, then one might be harder to push out. Or as you compare with other people, for labor and delivery nurses, most often that 9-pound baby took a little bit more effort than we saw the 6-pound baby. That's just the way it is. Although not always, surprisingly. And if you're loving tips like this and you would love more tips like this and would love to include your partner, I actually recommend doing a birth class, so you're not having to sit here and watch all 200 videos on my YouTube channel, and you're also involving your partner. I actually have a class that I recommend. I'm going to link it down below for you. The next one is all about your pelvis, and it actually has a little bit to do with kind of how it's tipped. So, you'll see people who, stand with their butt out a little bit more versus people who stand with it tucked a little bit more. And so sometimes your pelvis is just tilted in a different way, or it has a more narrow opening for the baby to come out. So there's a couple of different ways that your pelvis can be involved with how long it takes to push. And again, using movement throughout your pregnancy. This is why I recommend still doing squats and lunges, even though they are the absolute worst during your pregnancy, because it does help your pelvis become a little bit more maneuverable and gets it in a better position for baby to maybe get in the right spot when you're pushing. That being said, if it's your pelvic outlet, there's nothing you can do about it. Some people are just born with a very small pelvic outlet, and thank goodness you're not a pioneer, because you probably would have died during birth. And a lot of times those people end up having a C-section, and thank goodness we have C-sections for things just like that. Sometimes I hear online that everyone's baby will be able to come out of their pelvis. And I'm here to testify that that is not the case. There are some people where the baby is literally just too big to come out of their body, which is, again, glad I'm not a pioneer in so many ways. And while we're talking about exercises, one of the things I encourage people to do is a lot of us just think walking, right? That back and forth motion, but you're looking to do things that move your pelvis in a different way. So those side lunges, using a yoga ball to do those sexy hip circles, because a lot of us only do this back and forth motion with our pelvis, but we need to do it more in a circular motion, and squats where our knees are coming out to the side and things like that. So make sure that you're incorporating your pelvis and different pelvic movements into your workout routine. And if you have any questions, talk with your provider or see if you can see a physical therapist, or perhaps they have someone that they can recommend that does like prenatal yoga or prenatal workout classes either in your area or here on YouTube. There's a lot of great channels that have great workouts on YouTube as well. So many of us have a desk job where our pelvis is in one position all day. So we're working to change that by the exercises that we're doing when we're not sitting at our desk. And if you have a job that you get to move your pelvis in different ways, like nurses, it will be a benefit to you at delivery, I think. Number 5 is effort. There are some people that are just better pushers than other people. And here's the sad news. I will say that a 16-year-old is a great pusher-outer of a baby. If you're 16 watching those videos, you are going to have less issue pushing out your baby than somebody who's like 40. So, if we have better ab muscles, we're usually a better pusher. Some people just don't have that effort in them, or they're just built differently. But effort is definitely part of it. Is 16 a great time to have a baby? No, but is it a great time to push out a baby? It absolutely is. As soon as those girls get focused, they have a baby like that. I'm telling you. I cannot tell you how many 16-year-olds I've almost delivered because all of a sudden they just turn into She-Ra and have a baby. The last one is actually how you push. There's different types of pushing. There's open glottis and closed glottis pushing. And the good news is I have a whole video on different ways to push that you guys can watch. I think that one will be super helpful because there's a lot of misinformation spread online about the different ways to push and when to use them. So be sure and watch that video. But thank you for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.